My name is Cosette. I am a nurse at Parental Children's. I work in the Rapid Treatment Unit. Today we're talking about bronchiolitis. Bronchiolitis is a common infection in young children. In bronchiolitis, it's a viral infection of the small airways in the lungs. When the small airways get infected, it makes it very hard for a child to breathe and causes mucus in their lungs. You have probably heard about RSV, which stands for respiratory syncytial virus. It is the most common virus that causes bronchiolitis, although there are many other viruses that also cause bronchiolitis. Bronchiolitis happens all year round, but it is most common in the winter months. Bronchiolitis usually starts with symptoms such as a mild cough, runny nose, congestion, and sometimes a fever. After a few days, the infection spreads to the bronchioles, which eventually causes wheezing, difficulty breathing, and severe coughing. Bronchiolitis will usually go away on its own. However, it may take a couple weeks for the cough and the congestion to go away. A child gets the virus by coming in contact with people who also have the virus. They can also get it by touching things that people with the virus have also touched. There may be times, however, when you should seek additional medical advice. First, you should call the doctor if the child shows any signs of having trouble breathing. This can include sucking in the areas between the ribs or above or below the rib cage. These are known as retractions. Retractions can range from mild to severe. This happens as your child tries to get more air in the lungs. If your child is not drinking well or has fewer than 4 wet diapers in a 24-hour period, you should call the doctor. Call if your child has a fever that is over 100.4 degrees Fahrenheit or 38 degrees Celsius for more than 48 hours. Finally, if your child is under 3 months of age and has any fever, you should call the doctor. Though some children with bronchiolitis will need hospitalization, most children can be watched and managed at home. Diagnosing bronchiolitis does not usually require testing, but can be diagnosed with your child's symptoms and their physical exam. Your child's own immune system will fight off the virus. Antibiotics are not effective in treating bronchiolitis, as antibiotics only fight off bacteria and not viruses. Cough and cold medications over the counter are not recommended, as they are not effective and can have serious side effects in children. There are a variety of ways to suction at home, such as a bulb or a nasal aspirator. Suctioning may also be done at your doctor's office, at the hospital, or at a respiratory clinic. You can do a few things at home to help your child breathe easier and feel more comfortable. You can suction their nose, use a cool mist humidifier at night, be sure that your child drinks well to stay hydrated. If your child is at least 6 months old and has a fever, give them ibuprofen or acetaminophen as needed.
Hi, my name's Elaine and I'm a registered nurse at Primary Children's Rapid Treatment Unit. Some children with bronchiolitis can have low oxygen levels because the airway swelling and mucus can make it difficult for them to get enough oxygen. If so, they are going to need extra oxygen through a small nasal cannula. If your child is not drinking or having a difficult time drinking, they may become dehydrated. If they are needing oxygen or they are dehydrated, they will likely need to be hospitalized. The main things that will determine when your child is ready to go home are how much oxygen your child needs, how comfortably your child is breathing, how well your child is able to drink, and if your child's providers have any other concerns that need to be watched in the hospital. In general, you can expect your child to be discharged when they are breathing comfortably, on room air, or on a small amount of oxygen. Your child must also be drinking well enough to be able to stay hydrated.
Frequent and thorough hand washing is the best way to prevent the spread of any virus, especially after sneezing, coughing, or blowing your nose. Make sure your child is up to date on their immunizations, including the flu shot, and as always, do not smoke around your child.
While having a child with bronchiolitis can be difficult and scary, it is generally very treatable, and the child usually makes a full recovery. Let's hear from some parents who currently have a child hospitalized with bronchiolitis to see what their experience is like.
Really wheezy for a few days, and kind of grunty breathing. He would hold his breath every once in a while, just kind of. We couldn't get his fever to go away, and he started vomiting. We decided to take him into the Instacare. They checked his oxygen levels, and they were pretty low, so we got referred up here to Primary Children's. First, they suctioned. They noticed a lot of phlegm and mucus in his chest, so they got him on oxygen after his levels were low, and then deep suctioned out his nose, which was really helpful for him almost immediately. Because he hasn't been feeling well, he's also been really dehydrated. So after the first probably 12 hours, I guess, they put him on an IV for fluids. But the major treatment was oxygen and deep suction.